This program contains actual surgical procedures. Viewer discretion is advised. The Long Island Plastic Surgical Group is the largest practice of its kind in the U.S., comprising 12 surgeons specializing in every facet of plastic surgery, as well as running the country's leading plastic surgery teaching residency. The group has been providing care to the people of the New York area and beyond since 1948, and now sees around 1,000 patients each week through trauma and burns work at nearby Nassau University Medical Center, the groundbreaking cleft lip and palate group, to more conventional cosmetic work. Over the years, the group's offices in Garden City, New York have been the scene of some amazing human stories. For the first time, our cameras have been allowed to follow the triumphs and transformations all taking place an hour from the heart of Manhattan. It may seem perfectly normal for 20-year-old Allyson to get her cousin Deirdre to help her with her makeup, but Allyson's arduous makeup routine has its origins in tragedy. 5 years ago, and just yards from her house, Allyson was involved in a serious car accident. The crash left Allyson with a severe scar to her face. A patch of scar tissue several inches wide runs from her hairline to her eyebrow, which itself has been totally destroyed.
I remember going into the X-ray room and seeing my reflection in the mirror and just being like, oh my God, what happened to my face?
Allyson and Deirdre, who was also in the car that night, revisit the scene of the crash and recall how Allyson has come to terms with her accident.
I have such awesome friends and awesome family that have helped me so much through my accident, that kept my head up the whole time and kept me laughing. Love you. Rita.
But it's okay because she's so beautiful, not only outside but inside, and it's just wrong.
Over the past 5 years, Allyson has come a long way and has already undergone 4 operations, including 2 skin grafts. But she still needs Deirdre's help to reconstruct her eyebrow with makeup.
Having to put on makeup to reconstruct my eyebrow is very frustrating because it just doesn't look natural to me.
It's her hope that her final surgery at the Long Island Plastic Surgical Group will give her back her old face. Deirdre will be able to put away the concealer once and for all.
Okay. What do you think?
I think it's good for now, but after your surgery, we won't have to do it ever again. It'll be all better.
Yep. Just takes time.
Allyson may look like any fun-loving American girl, but unlike her friends, for her, the past 5 years have involved an ongoing course of plastic surgery to reconstruct her scarred forehead and eyebrow following a severe car accident.
After the car accident, I kind of had to build up my self-esteem a little bit because I would look at every morning I'd wake up and look in the mirror and just see my face all scarred, and I've been having to put makeup on my left eyebrow to make it look more natural. Like, I do have an eyebrow there, which was very frustrating for me for over the years, but hopefully after this last surgery I'm not going to have to do it anymore because hopefully it's going to be the last one.
Hi, Allyson. How are you?
Good, how are you?
Fine. Okay. Oh, this is new. Is that?
No, yeah, that's new.
So your plastic surgeon notices everything.
Yeah.
Okay, let's take a look.
Today, she's seeing Dr. Leyland Dean of the Long Island Plastic Surgical Group as he examines her in preparation for what she hopes will be her last operation.
Okay, great. The hairs we put in last time are really doing very well, and they're growing in the right direction, and it looks good. Great. What we're going to be doing next week is take some hair from the back of your head right here, just adjacent to where we took it last time, and then we'll have you relax and have a little bit of juice and read a newspaper, and I'll be taking that little hair and making smaller hairs out of it and making single hair units, and then we'll have you come back and I'll give you a little local anesthesia here, and we'll put those hairs in as single units. And actually, I think it'll work out very well. This may be the last time we need to do this.
Although she is only 20, Allyson is a surgery veteran.
Towards me a little bit.
Allyson is at the Long Island Plastic Surgical Center, where Dr. Dean will be operating on her for what she hopes will be the last time.
This is all new eyebrow. So she had no eyebrow medial to this, and she's more dense over here. It would be nice to increase the density. Allyson will tell you that they grow at different rates, her eyebrows, because the hair back here remembers that it was hair back here.
Yeah, I trim it a lot.
You trim it a lot. Trim it a lot. But if we could make the eyebrow more dense, that would be great.
Dr. Dean reconstructs Allyson's eyebrow by inserting whole hair follicles, which he has harvested from the back of her head, into tiny slits in her brow.
A little pressure, sorry.
The new hairs are a perfect match in color, and thanks to Dr. Dean's care, they will grow in the right direction. "5 years ago, following a car crash, Allyson thought she would never get her looks or self-esteem back. But now, thanks to Dr. Dean, she and Deirdre can put aside the concealer once and for all.
I don't have to painting your face anymore.
In fact, to say goodbye properly, she and Deirdre, along with her parents, are burying the makeup under the very tree where the accident occurred.
I might be.